I'm Jay, and this is my son Finn. He's agreed to be my patient for this video, and I give consent for him to be in it. We will start with the abdominal exam. So I've washed my hands. You've gone to the bathroom, so you're going to be comfortable for this. So we will start with inspection, and I am looking to see that his abdomen has a normal contour. It's flat. I don't see any scars. I don't see any ecchymosis, jaundice, striae, or any other like bulging or deformities. And then I will auscultate. Starting with the diaphragm of my stethoscope, I will listen in all 4 quadrants, expecting to hear 5 to 30 vowel tones per minute to be a normal finding. And then I will flip my stethoscope to the bell, and I'll listen for bruit or turbulence, and I'm listening at the abdominal aorta and the renal, iliac, and femoral arteries. And hearing no bruit, I understand that there's probably no turbulence in the veins. And from there, we will do some percussion. So I'm going to percuss his abdomen in all quadrants, expecting to hear tympany. And then I will also percuss to determine the liver span and where the spleen is. So for the liver, I'm going to percuss down the midclavicular line and upwards to find that border. So expecting tympany and then dullness over the organ. And then again, tympany as I move downward, move upwards till I hear that dullness again. So I find the liver span to be about here. And I would measure it, and then an adult male, I think 12 centimeters is a typical normal span. And then I would do the same on the other side. However, on this side, we're going to do the anterior axillary line, and here we're finding the spleen. So I will percuss downwards, hearing tympany and then dullness over the spleen, and then percuss upwards, expecting to hear the same to determine where the spleen is. And now that I have listened and I've percussed, I'm okay to palpate. Is anywhere tender, Finn? No. Okay, so I would start with light palpation. Does anything hurt with that palpation? If anything did hurt, I would start my deep palpation in an area away from the light palpation. But since there isn't anything tender, do some deep palpation. Am I tickling you? Okay. So I don't feel any guarding. The abdomen is soft, and he's told me that it's non-tender, and I don't feel any masses or anything like that. I would now palpate for the liver and the spleen. I can do a couple different techniques. I can put my hand behind his back and find that border of the liver, expecting to find it to be smooth. Stop flexing.
Not my back.
Or I could also go in and do a hooking technique to find that liver border. And then I would do the same on the other side to find the spleen. Kind of turn towards me a little bit so he can rotate, and that can move the spleen closer. And it's normal for me to not feel the spleen. Okay, and then I will palpate for the aortic pulsation. Relax.
I am relaxing.
Okay. So I'm palpating for the aortic pulsation and using my other hand to estimate the width of the aorta, and in an adult, 3 centimeters would be a normal finding. Okay, I'm gonna have you sit up and turn around so your back's this way. Okay, that's fine too. So now assess for CVA tenderness. Does any of that hurt? Nope, and no CVA tenderness. Okay, so go ahead and flip around. We're going to start with our musculoskeletal exam. So why don't I actually have you stand up, Finn? Okay, so I'm going to do the neck and the vertebral column in one smooth movement. So I'm starting by inspecting the neck. And in this whole exam, I'm looking for any gross deformities, and I'm looking to see that both sides are symmetrical. I'm not seeing any masses or skin changes. So I see his neck is free from any deformities. There's no obvious skin changes either. And then turn. And in a real exam, we'd have her shirt off. Also looking at the posterior on both sides and up and down this vertebral column, looking for it to be midline, as well as like the paraspinous muscles to be on either side to be free of any deformity or swelling. Stand up straight, please. I'd also assess for that sacroiliac joint, looking for just about a straight line up and down. And then I'd palpate your turn around again. So palpating the neck, just feeling symmetrical musculature and good tone. And then turn again. Sorry, we're gonna do lots of turning. And the same, feeling along the paraspinous muscles, going from the neck all the way down to that sacroiliac joint. Is any of that tender? Oh, okay. And then I'd also palpate the vertebrae. So tell me if any of this is tender. So I'm looking for midline tenderness, any crepitus, any step-offs. I'm just palpating each vertebrae all the way down, again, to that sacroiliac joint. Okay, I'll have you turn, and we'll do neck range of motion. So I want you to look up to the sky. Okay, so that's flex, that's extension, and then look down. We have flexion, easy. Okay, look straight ahead. I want you to turn and look over the shoulder. Turn and look over your other shoulder. Okay, look straight. Turn your ear to the shoulder, ear to the shoulder. Okay, push your head against my hand. Oh, sorry. You can just put your ear to your shoulder again.
Go like that.
Yep, there you go. And do it again. And then turn your head against my hand to look, and then the other way too. So we have normal strength and range of motion in your neck. Now let's check your back. Lean over and touch your toes. Okay, and then also kind of look up and bend backwards. There you go. And then I want you to bend at your waist to either side. There you go. So good range of motion, that is normal. And I have good strength in his neck. You can stop now. And then next we will do your upper extremities. So I'm going to inspect his shoulders, looking at the front from the clavicle all the way out to the joint. And then again at the back, looking from the scapula all the way out to the shoulder. And again, looking for symmetry between both sides and assessing for any obvious gross deformities or skin changes. Then I will palpate. You can sit now probably. Okay, so I'll palpate, feeling all the bony prominences, feeling for musculature and tendons. And everything I do on one side, I would repeat on the other side. Okay, and don't have any abnormalities. So now we can test for range of motion with your shoulder. So I want you to bring your arm out in front of you, and then raise it up to the sky, and then bring it down and back. Okay, and then we're gonna bring it out to the side. So this is abduction, and then bring it across your body for adduction. Okay, and then can you bring it back behind your back? And bring it up and behind your head, touch your back. Great, so I have normal range of motion in his shoulder, and then I repeat the same on the other side. So now we will inspect the elbow. So again, comparing to the other side, looking for any asymmetry, easy, and any gross deformities and any skin changes, any warmth, swelling, any indications of like infection in any of the joint assessments as well. So then I will palpate for the lateral and medial epicondyles and the olecranon process. And none of that hurts. Okay, so now we will assess range of motion. We're gonna do a flexion, so like a bicep curl. So bring your arms out and bring them in, and extend. Okay, good. And then bring your arms up against my hands, and then turn your hands outward, and push down. Okay, and then I have normal strength there as well. So then I would continue my assessment down, inspecting the wrist, the hand, and the fingers. So again, here, comparing both sides, looking for deviations from symmetry, any gross deformities or skin changes, any warmth or swelling. So starting at the carpals, palpating, and then moving down to the metacarpals, palpating along each bone, and then palpating down through each joint in the phalanges. And then we will do range of motion in your hands. So bring your hands out like this. I want you to bring them up to, here, keep your arms level. There you go. Bring your hands up to the sky, point your fingers down, bring them straight forward, turn them inward, leave your elbows this way, and then just turn your hands inward as much as you can. And then turn your hands outward, then bring them back to midline. Open your fingers, close them, hold your hands up, show me a number 4, pull your thumbs out, okay, bring your hands back down, and I want you to spread your fingers against my hands, okay, and I have good strength there, and I want you to pull your hands up towards, not your arms, just turn your hands up towards the sky against my hands, and then push down, okay, bring your arms up, push me away, and pull me in. Okay, and I have normal strength there as well. Good job. Okay, and then I'll have you stand up again. So now I will assess his hips. Again, looking for symmetry, identifying the iliac crest on either side, seeing if they're even, and then turn around. We're gonna look at the other side as well. Okay, and then I'll start my palpation at the iliac crest, coming forward along the anterior spine, and then down through the sacroiliac joint, and then locating the greater trochanter as well on either side. Sorry, is that tickling you? Okay, go ahead and lay down. So I would like you to bring this knee up to your chest as tight as you can. So that is our flexion, and then turn over on your belly, and you're gonna do a swimmer's kick. I want you to bend right at your hip and kick your, yep, there you go, there's our extension. You can flip back over, come close to this way. Okay, and we're gonna adduct, so move your leg away from your body, and then we will, no, abduct, move your leg away from your body, adduct, move it across your body, okay, and then bend your knee, and I'm gonna have you do outward rotation and inward rotation, okay, so we have normal range of motion with your hip. Go ahead and turn this way. Now look at your knees. Once again, comparing for symmetry on both sides, looking for any obvious deformities, any swelling, any redness, any other skin changes, and I see none. And then I will palpate. Again, what I do on one side, I would do on the other. So I am locating the patella and then assessing the joint compartment. This all feels normal. Do you have any pain with that? Sorry.
No.
Ticklish? Okay, and then also palpating the tibial plateau here. And then, hi. Here, separate your legs. Okay, so we will assess your range of motion with your knee. Go. So I want you to bring this leg up, kick it out, and then pull it back down. Okay, and then easy. I want you to push your legs against my hands and then pull them back down. And so I have good range of motion and normal strength in his legs. We need to move down towards, we'll do your ankle and your foot and your toes. So I'm assessing his ankles for symmetry, gross deformity, any swelling, warmth, skin changes, and I see none, they appear to be normal. And then palpating the medial malleolus and the lateral malleolus, the calcaneus, the plantar fascia, moving down through the tarsals and the metatarsals, and also the phalanges. Popping down along each bone, and then also rotating the toes a little bit here. Okay, so I will have you, I want you to, this will be our dorsiflexion, so I'd like you to bring your toes up towards the sky and then point them down, and then we will do passive inversion and eversion. Okay, why don't you turn your legs this way for me? No, just lay, there you go. Lay down, and I want you to pull your toes up to the sky and step on the gas, and I have good strength in your feet. Go ahead and turn this way again, and we'll do your reflexes. So I'm going to start with your biceps reflex. So relax your arm here, relax. Okay, and I'm going to place my arm on my hand on the tendon. So I have my biceps reflex, and then I will move on to the triceps reflex. So relax your arm, buddy. Let your arm just hang in your lap, and I will strike just above and posterior to the elbow. And then moving to the brachioradialis, so just about 2 to 3 inches above the wrist. And then we will move to the patellar reflex. So let this leg just hang and relax. Okay, and then we will move to the Achilles reflex. I'm gonna do this ankle because I think you can see better a little bit. So I'm gonna hold on here and just strike right at the tendon. And then we will assess the Babinski reflex. This is your favorite. Sorry. So the Babinski reflex is what I would assess on his foot as well.
Like a knife.
Are you okay? Okay. And now we'll do our neuro assessment. So he walked in here. I know that he is alert and oriented. And we will do a cognitive function test. So, Finn, can you count backwards from 100 by sevens?
93, 86, etc.
Etc. Perfect. And we would continue on as well as we could from there. And then we will also assess higher intellectual function. So can you tell me what is similar between a hamburger and a hot dog?
Meat.
They both have meat. That's great. Okay. And I think now we need to move to our cranial nerve assessment. So cranial nerve number 1 is olfactory, and we are deferring that exam. Cranial nerve number 2 is our optic nerve. So we would assess for acuity with a Snellen chart. So this chart is designed to be 10 feet away. So I'm 10 feet away. And Finn, can you read this line for me?
PECFD.
Great, and that is on this chart.
I'll read the last one.
Yeah, read the last one. Can you read that?
LEFODPCT.
Okay, so that was with 2 eyes. We would repeat the same with the left and the right eye. And then we would also assess visual fields. So I want you to look straight at me and tell me how many fingers I'm holding up, okay? So
2.
don't look at my hand. Look straight at me. You're using your
number.
you're using your peripheral vision. How many fingers am I holding up?
4.
Okay.
1. 2. 3. 5. 2.
Okay, so cranial nerve number 2, the optic nerve, is intact. Next is going to be our oculomotor. So I will assess your pupil constriction and your eyelids. Your eyelids have good tone. They're even. They're not drooping. That all looks fine. So I want you to look straight ahead, and I'm going to shine a light in your eyes. Okay? So I had good constriction and consensual constriction as well. And so that was number 2. Number 3, that was number 3. We're on number 4 and number 5. Number 4 and number 6 is what we test together. That's the trochlear and the abducens. So we're going to check extraocular movements and convergence. So I want you to look at me, And I'm going to move my pen light and an H pattern, and I want you to follow it with just your eyes, not your head. And as we're doing this, I'm monitoring for nystagmus, strabismus, any unusual eye movements. Okay, and I want you to look at this, and I'm going to bring this closer to your face, okay? Follow with your eyes. Okay, and I had good convergence and pupil constriction when it got closer to your face, so that is also intact. We are now at the trigeminal nerve, and here I want you to, I'm gonna come down here for you. I want you to clench your teeth, okay, and then relax, wiggle your jaw from side to side. Okay, and then I'll check for sensation. I want you to tell me, close your eyes, if this is soft,
Soft.
sharp,
Spiky. Soft.
sharp. So
Spiky.
we're assessing the difference between soft and sharp sensations.
Spiky.
And then we'll do your facial motor is number 7. This is the fun one. So I want you to raise your eyebrows and look really surprised. And I want you to wrinkle your forehead. And then close your eyes really, really tight. Okay, and then smile. And puff out, big smile. And then puff out your cheeks. Okay, and I want you to turn around so you can't see me. So the next one is 8. This is our acoustic nerve. So I'm just going to be a few feet behind you, and I'm going to have you cover up one ear. So remember how I showed you, cover up with your tragus and kind of give it a little massage. And I'm going to say a series of 3 letters and numbers, and I want you to repeat them. Ready?
B84.
Okay, great. And we would do that with the other ear as well. So cranial nerve number 8, our acoustic nerve is intact. Next is our glossopharyngeal and vagus nerve. So your turn, and I need to see your mouth. So I am going to have Finn say ah, and I'm watching for the uvula to move upwards in midline, and I'm also watching for the soft palate to come together like a curtain. And then next is our spinal accessory. That is, those were 9 and 10. Now this is 11. So our spinal accessory, I want you to pull your, great, shrug your shoulders up against my hands. That one is intact. And then I want you to, again, have you turn your head against my hand. Okay, and that has good strength and good motion there. Okay, good job. And then last one, number 12. Is hypoglossal, and that is articulation, and he's been speaking clearly to me, so I know that that is intact. I'll just have you stick out your tongue. So his tongue is midline. Can you move it to the left, move it to the right, up, and down? So that is intact as well. And I think, we need to do soft and sharp all over your body. So we'll assess for differentiation between sharp and soft sensation on all extremities. So close your eyes and tell me if you feel soft or sharp.
Soft. Sharp. Soft. Sharp. Soft. Spiky. Sharp. Sharp.
And we would repeat on the other side. And then we will also do, I want you to put your arms at like a 90-degree angle, and I want you to quickly turn your hands, go back and forth, okay? And you can stop. So let me give you the instructions. I'm gonna hold my finger in front of you, and I want you to go back and forth, touching your nose to my finger. Okay, great, and switch sides. Okay, awesome. Okay, you can be done. And then we will assess gait. So when he walked in here, he had a nice, steady, stable gait. I'll have you stand up though, and we're gonna do the tandem walk. And I hope that we can see this on the camera. So tandem walk, you're gonna walk heel toe like you're walking on a tightrope, okay? No, that's wide toe. Just walk heel toe, just like you're walking on a, can I show you? So I want you to do heel toe.
Just like
Like you're walking on a balance beam. Yep, so come back here and do it.
Like heel and then
You're out of the frame, so come over here.
heel
Yep, heel,
and then
toe.
heel.
Okay,
Toe.
so we're doing our tandem walk successfully. We have a normal gait, and that concludes our exam. Thank you.
B